But the reality is, the journey that I had was I founded and conceived the first federally certified spine center of excellence in the East Coast United States. And it was here in Orlando. And we did it under a big hospital umbrella system, the Orlando Health System. And, what we learned in building this center of excellence, if you will, it was all through data tracking and data matriculation, but then a perpetual clinical optimization strategy. We got our lengths of stays in the first couple of years down from 3.6 days down to 1.4, and people say, oh, it's all about money. No, it really wasn't. It was about being out of bed a few hours post-op. It was being ambulatory quickly. It was having no Foleys. It was not getting transfusions. It was guaranteeing that you were reducing the number of medication not only received, but the errors because of the medications received. And every piece of the puzzle got simpler and simpler and simpler. And then eventually we evolved to a point where the clinical pathways had improved so much that, wow, people were leaving day of surgery. Well, it didn't take long before it occurred. We had data to prove it, that our outcomes and our complication rates for people that went home day of surgery were so much less than people that stayed in the hospital overnight and beyond. And it was for all of those secondary, people are independent at home. They're walking, they're going up to the bathroom by themselves. They're walking outside. The homes are, even if they're dirty, they're dirty relative to them. They're not dirty relative to a hospital with all of the different bacteria. Our infection rate dropped to zero. I mean, overnight by doing outpatient surgery. So, for our perspective, I would rather do surgery in an outpatient environment, reducing the inherent risk of complications. And if somebody does need to be admitted, we can still admit them to the hospital for aftercare. But, most of spine surgery patients are healthy people in a spine health crisis. They're not sick people. And it's a different zone when you have, critically ill people with epidural abscess or TB or, cancer or, that's a different complexity. But 90% of spine surgery isn't that.